Hi, I'm Bill Rapisi, Executive Director of Lymphatic Education and Research Network, and I just want to take this opportunity to thank all of you for joining us today for our symposium series. I also want to take this opportunity to thank all of you who become members of LE&RN and help support this series so that we can continue bringing this kind of groundbreaking information to you in your homes and offices. I would also suggest for all of you who have not become members of LE&RN, $5 a month, you can become a member of LE&RN and help support this programming and the research that we do. Thanks very much for joining us, and I look forward to having you become a member.
My name is Cynthia Shechter, and I'm an occupational therapist in New York City, specializing in both lymphedema and breast cancer rehabilitation. Before I begin, I'd like to thank the Lymphatic Education and Research Network for inviting me to do this webinar, and Brenda Fadiibi, a colleague of mine, for helping me put this presentation together. Although lymphedema is not a curable condition, there are things that can help to ease the symptoms many individuals experience. During this presentation, I will be discussing specifically manual lymphatic drainage and exercise. Although I'm sure that this audience has a clear understanding of lymphedema, I'm going to do a quick review of the lymphatic system and some of the types and symptoms of lymphedema. First, let's discuss the lymphatic system. The lymphatic system works closely with the circulatory system to transport fluid from the tissue into the bloodstream. The lymph system breaks down large protein molecules into smaller ones to facilitate reabsorption into the bloodstream. Lymphedema itself is an accumulation of protein-rich fluid in the affected area, typically an extremity. So what are the types of lymphedema? There's primary lymphedema and secondary lymphedema. First, let's discuss primary. It has been my experience that in cases of primary lymphedema, people go from doctor to doctor in search of a diagnosis before being able to find appropriate care. That's why organizations like LE&RN are so vitally important to both raise awareness and support those affected by lymphedema. Primary lymphedema is categorized by an abnormality in the actual lymph vessels affecting fluid reabsorption. I believe that one reason that primary lymphedema progresses is because it is not diagnosed or managed appropriately at the inception of swelling. This could be because people think that they just have an onset of unknown swelling and they don't seek medical care, and it might be that their physician or medical professional is unfamiliar with the diagnosis. The most common types of primary lymphedema would be congenital lymphedema, which is detected at birth or in the first year of life, lymphedema precox, which comes on at puberty, and lymphedema tartar, which occurs after the age of 35. Now, secondary lymphedema. Secondary lymphedema can occur at any time post-operatively or post-radiation. It occurs when lymph nodes are damaged from typically oncology treatment. Patients who develop patients have developed lymphedema within months of their care or up to 40 years post. There's no rhyme or reason, which is often very frustrating. Secondary lymphedema is generally caused by an obstruction or damage to the lymph system that interrupts lymphatic flow. It can also occur after trauma. For example, a severe leg injury after a motor vehicle accident. Somebody can end up with a chronic swelling problem, often termed lymphedema. So what are the symptoms of lymphedema? Symptoms vary from patient to patient. Some people say that they never even noticed that they ever had a problem until their arm became very swollen or their shoe began to not be able to fit. But most commonly, the complaints that you hear about are swelling, heaviness, tightness, firmness, aching, numbness or tingling in the extremity, and decreased range of motion. I know that the topic of this presentation is manual lymphatic drainage and exercise to ease the symptoms of lymphedema, but I feel that it is important to touch upon the psychosocial impact of lymphedema since it is so prevalent. Lymphedema affects individuals in all aspects of their lives, from going out with friends to getting dressed for an event to finding shoes to wear to the office. People tend to decline invitations to go out simply because it is easier than searching for what to wear. They're not able to sleep, typically have difficulty in social environments, and my personal catchphrase is that I want to help people learn to live with lymphedema rather than for it. So I'd like for people to be able to manage their symptoms to the best of their ability, but still be able to go out and do the things that they need to and want to without issue. Another portion of the psychosocial aspect of lymphedema is people at work. Work is necessary for people to meet their needs, sustain their home and family life, help with self-identity. But honestly, it's difficult for individuals to go to the office, find clothing that's appropriate for the workplace, in particular shoes or slacks for the office setting, which causes a lot of emotional distress, anger, frustration. People who perform heavy lifting in the office or their workplace often have to ask for assistance from coworkers because they're not able to bend or they're not able to reach to a certain point, and that can get very frustrating. So what can we do to manage the symptoms of lymphedema? Well, the goal is to reduce the overall size of the extremity, to improve symptoms and overall quality of life, reduce risk for infection, and teach self-management techniques so people can live their lives without having to worry about their lymphedema. Management of the symptoms of lymphedema is important on so many levels. The reduction of swelling will not only help with the psychosocial aspects, it will improve overall quality of life, reduce infection risk, and decrease the size of the limb. There are many treatment options for lymphedema, and I find that a combination of everything listed on this slide works best. So you do manual lymphatic drainage, multi-layer compression bandaging, which I'm going to touch upon, compression garment use of the vasopneumatic compression pump, a skin care regimen, and exercise. So what is manual lymphatic drainage? I've been talking about it a lot. Manual lymphatic drainage, as stated by Leduc, reroutes the stagnant lymphatic fluid by stimulating healthy and more centrally located vessels and nodes that ultimately drain into the venous system. The resulting increase in lymphatic activity in healthy areas creates a suction effect, which stimulates the built-up fluid to travel to an area of normal lymphatic drainage. Following the activation of the healthy lymph nodes in these areas, the treatment moves to the areas that are swollen, starting with the most proximal and progressing to the most distal part of the affected extremity. Manual lymphatic drainage is a generally safe technique with no side effects. However, contradictions for treatment include cardiac edema, renal failure, acute infections like cellulitis that are not being treated by antibiotics. Typically, individuals who have been on antibiotics for 24 hours are cleared for therapy and are not at risk for a spread of the infection, so they can begin to participate in therapy. Deep vein thrombosis is always a contraindication, whether in the upper or lower extremity. It's always best to consult a physician before beginning manual lymphatic drainage if a patient has any of those conditions. As a therapist, what we're working to do is reroute the fluid. So we're working on pathways in the neck, in the unaffected axilla or groin, in the abdomen and trunk, and all of that will help to facilitate drainage from the affected extremity. Typically, treatment sessions last between 45 and 60 minutes, and for optimal results, I usually recommend 2 to 3 times a week. So what are the effects of manual lymphatic drainage on the body? Aside from reducing girth, manual lymphatic drainage has other therapeutic benefits. It increases venous return, has soothing and analgesic properties. It helps break down hard, painful, fibrotic tissue to alleviate discomfort. and ultimately improve quality of life. Now I'm going to discuss multi-layer compression bandaging, which is typically applied after manual lymphatic drainage prior to performing exercise. With multi-layer compression bandaging, the bandages are short stretch. This means that they provide a low resting pressure and a high working pressure. This low resting, high working pressure allows muscles to contract against the bandages, creating a pump-like or vacuum effect. They also assist in decreasing tissue fibrosis. I know that a lot of times people wear bandages consistently for a period of time and then stop using them and use a compression sleeve. What I try to do with my patients is work with them on finding a wearing schedule that will work for their personal life. If somebody can only tolerate wearing the compression bandages for 2 to 4 hours, then that's all that they can do, and that's okay. Some bandaging is better than none. Use of the compression sleeve certainly helps because it helps keep fluid from refilling in the extremity, but the compression sleeve is an elastic compression that does not assist in the reduction of swelling, so it prevents increased fluid from coming down the extremity. Now I'm going to discuss exercise. So what are the types of exercise? There's remedial exercise, flexibility, breathing, resistive, and aerobic. First, I'm going to discuss remedial. The purpose of remedial exercise is to get an individual back to their prior level of function and to restore their range of motion. What kind of exercises can we do? Anything that increases movement. So we can do active range of motion, active assistive, passive, even Tai Chi. With Tai Chi, individuals breathe deeply from their lower belly, and in harmony with the movements, all movements are performed in a smooth manner with no unevenness and continuousness, allowing no interruptions. The entire body moves as a single unit, and all movements come from the center to correct position of the chest and back. So it's working the entire time on restoring range of motion and posture. Next, we'll talk about flexibility exercises. Flexibility exercises focus on opening all of the thoracic spine, core, and chest wall. They can include use of a half or whole foam roll, pulley, use of the therapy ball on the wall, corner stretches to open up the chest wall, the doorway stretch, wall slides for the upper extremity. For the lower extremity, gentle lunge position as a place and hold, use of the stretched out strap, or use of the foam roller are all very effective in increasing flexibility. Next, we'll talk about breathing exercises. Breathing exercises are very effective in stimulating lymphatic flow. To perform them appropriately, place your hands on your abdomen. As you inhale, push your abdomen out. As you exhale, allow your abdomen to relax. Your diaphragm and thoracic duct are two supplemental lymphatics that are stimulated with abdominal breathing. So while you're doing abdominal breathing, you're actually stimulating your lymphatic system to work better. Yoga is an exercise that utilizes breathing throughout and can be very effective in getting stubborn lymphatic fluid moving. Now, let's talk about resistive exercises. Resistive exercises can be isometric, where you're resisting your own movement, or isotonic, where you're using weights and resistance. Resistance exercise is important in both lymphedema prevention and lymphedema reduction and maintenance. When used with compression bandages, resistive exercises produce an excellent working pressure. One should always start with a light weight and gradually progress. Resistance exercise is so important in improving the function and quality of life in individuals with lymphedema. People can increase standing, walking, carrying. They're able to play with their children more actively and maintain their social lives. I hear all the time from my breast cancer patients that they were told to not lift more than 5 pounds post-operatively which is true initially, and typically until you're cleared by your physician, you should not lift more than 5 pounds. However, patients are becoming younger and younger, and they have young children. People with young children obviously have to pick them up. So doesn't it make more sense to work on strength and getting people's bodies ready to be able to lift heavier things so that they're not so much at risk for hurting themselves if and when they do have to do something that involves a higher weight? Some sample exercises. Flexibility would be the overhead pulleys, where you're actually performing an active assistive range of motion and you are stretching out the area. Seated rows are good for strengthening, and that's an example of a resistive exercise. Now let's discuss aerobic exercise. It works in 2 ways. It stimulates breathing, therefore stimulating the thoracic duct and diaphragm, the 2 supplemental lymphatics that I previously mentioned. It assists in weight loss and or maintenance, and improves muscle conditioning and provides a muscle pump, which is imperative in lymphedema reduction. Swimming is an excellent exercise for lymphedema and is one exercise that does not require you to wear compression. The water actually provides a very similar working pressure to that of the compression bandages. Walking, biking, yoga, Pilates are all wonderful aerobic exercises while wearing compression. Reduction of swelling is more significant when exercise is performed while wearing compression bandages rather than the compression sleeve, due to the high working pressure of the bandage versus the resting pressure of the elastic garment. When do you stop exercise? As with all exercise, stop if you're experiencing unusual symptoms. If symptoms of pain, joint inflammation, tingling, burning, swelling persist, you should contact your physician or rehabilitation therapist immediately. There is a lot of supporting research out there for exercise with lymphedema, both upper and lower extremity. Studies have shown that strength training assists individuals with lower extremity lymphedema to improve function, and has found that while wearing compression garments, there was no increase in lower extremity swelling due to lymphedema. Supporting research for upper extremity exercise with lymphedema. Research has shown that not only is exercise essential for the effective management of upper extremity lymphedema, a study performed by Luden et al. Found that 8 weeks of yoga with compression decreased tissue firmness in the affected extremity, which is very important because it's very difficult to reduce swelling without getting rid of the tissue induration, the firmness of the tissue. In conclusion, manual lymphatic drainage combined with an individualized exercise program helps improve symptoms of lymphedema. It improves function and decreases physical impairment experienced by individuals, as well as decreasing the psychosocial distress experienced by people with lymphedema. Thank you so much for listening to this presentation, and I'd like to use this time to take questions from any of the live stream viewers. We had a question come in from a gentleman in Kansas, I believe, who was looking for therapy. I would recommend that you contact the Lymphatic Education and Research Network and discuss with them where you could find treatment. They have an entire database of therapists and clinicians who would be able to help you. So hopefully that'll work. Many people have had questions regarding yoga after breast cancer surgery because their concern is that there are a lot of weight-bearing postures. They're 100% correct. Yoga does have a lot of weight-bearing postures, and initially, particularly within the first 2 to 3 months post-op after breast cancer surgery, it can be too much for someone's body, but there are a lot of substitutions that can be made, and if you go to a good yoga studio, they should be able to assist you in not having quite so many weight-bearing postures.
Will copies of your slides be available?
Copies of my slides and this presentation will be available afterwards on the Lymphatic Education and Research Network's website in their live stream section. I hope that this presentation was helpful for you.
Exercises. Do you have copies of exercises?
I do have copies of exercises that I am happy to share with LE&RN, and they will make them available to you. A sentinel node I had a question. Does a sentinel node biopsy mean that I am not at risk for lymphedema? The risk of lymphedema after a sentinel node biopsy is significantly less than the risk if you've had axillary node dissection, but it does not eliminate the risk. So you still have a small risk. I believe that the Cancer Society is now saying that it's between an 8 and 10% risk of developing lymphedema. What garments do you recommend for use during aerobic exercise, lower extremity primary lymphedema? Flat weave, compression stocking like Jobst or Medi? Well, honestly, I think any kind of compression is good. Always better to use the compression bandages if that's at all possible. If you use an elastic garment, any of the brands are good as long as you don't have a lot of rubbing in the knee crease and in the instep ankle crease area, because that'll cause irritation, and irritation can cause an increase in symptoms.
We have another question. Can I lift more than 5 pounds?
Absolutely. As long as you have started with very light weights, you can begin a weightlifting regimen. If somebody was a mountain climber before, they should be a mountain climber again. They just have to get their bodies ready.
And what are your thoughts on lymph node replacement surgery? Somebody writes.
Lymph node transfer surgery is newer. There's a physician, Dr. Corinne Becker. She's been doing the surgery out of France for probably about 20 years now. And she believes that it causes a 100% reduction. I believe that the lymph node transfer surgery is helpful for lymphedema. I think that for people who have chronic infections, are on antibiotics on a daily basis for the rest of their lives, I think that they're probably excellent candidates for the surgery. I don't know that the surgery is a cure for lymphedema, but I do see that it helps with symptoms significantly.
Okay, JC writes, I haven't exhibited any symptoms of lymphedema, although I know I am at risk. Should I wear a compression garment anyway?
I say no. I don't think that you need, if a system is working on its own, I think that applying a compression garment is going to disrupt the function of the system. So if it's working, I don't think that it's necessary to wear compression. A lot of people think that they have to wear compression on a plane because they are at risk for lymphedema. I know that this is controversial, and nobody's really quite sure whether or not you should wear compression. I usually recommend that if somebody wants to wear compression during a flight, then they should, but they should make sure that they wear a gauntlet as well, so not just a sleeve, but also have distal compression on the hand, because if fluid has a choice of going up or down, it will always choose to go down with gravity.
And Melinda writes, is there value in electric stimulation HVPC in LE?
Honestly, I'm not familiar with using electric stim for lymphedema. I think that it would probably be assistive for pain reduction. I don't know that it stimulates the lymphatic system, but if I find any research on it, I will certainly share it with the Lymphatic Education and Research Network.
And Jane writes, is it true that if I exercise for 1 hour, I should rest for 2 hours?
No, I don't believe so. I think that you should do a cool down, but I don't see any value in taking a 2-hour break.
And Natasha writes, what do you find effective treatment for breast edema?
Breast edema is tough. I think manual lymphatic drainage works wonderfully for swelling in the breast. I also typically recommend that people wear compression bras, not necessarily the prescription compression bra. Many people find it more comfortable to just wear a sports bra as opposed to wearing your typical bra. And really manual therapy works the best.
Kelly writes this, that it's hard to use foam and compression wrappings and then be able to wear shoes for exercise. Any suggestions for that?
Agreed. I actually don't typically use foam when I'm doing the bandaging. I use the Artiflex cotton to protect the creases, and sometimes it goes all the way up the leg. But I don't typically wrap with foam because I find that it does limit function significantly.
Okay, and Tracy writes, my therapist does MLD on my face as well. The fluid gathers around my right ear and the pressure is painful. Is this necessary to do to the face? I do from the neck down.
So Tracy, from what I understand from your question, when your therapist performs the drainage on your actual face, the fluid gathers by your ear, that sounds like maybe the pressure is off or it just isn't agreeing with your system. So if it's not working, I would not do it. I typically stimulate the terminus, which is at the hole by your collarbone, and then I do work on the neck. I don't do drainage on the face for every client.
And Jose writes, how good is exercise combined with MLD without any other compression?
The problem with not using any compression while doing exercise is that when you're exercising, you're vasodilating, which means that you're increasing blood flow to the extremity. When you're increasing blood flow to the extremity, you're putting yourself at some risk of having that fluid pool. That said, if you're someone who has mild swelling, has manual lymphatic drainage, does exercise, and you don't see an increase in symptoms, then you can continue going on like that. I think that a lot of times we have to go by what your body tells you.
Kelly writes, I've noticed a worsening of my lymphedema after a month's use of a CPAP machine for sleep apnea. I've not found any comments on this online. Curious if anyone has any experience with this.
I've never heard of an issue using CPAP, although if you're experiencing increased symptoms, then it must be so for at least your body. Typically, that wouldn't be the response, though, because you're stimulating your breathing, which should actually be helping with the reduction of swelling. I would definitely speak to your pulmonologist about that. Okay. If anybody has any more questions, you can always email the Lymphatic Education and Research Network, and I'm happy to answer.
Facebook is a good place.
Facebook is also a very good place, and I'll have access to all of that. Thank you so much for your time, and I hope you enjoyed the presentation.